So good afternoon, everyone, and I'm delighted to welcome everyone who is here with us live in the UK and also all our virtual delegates joining us from across the world. In this session, I'm going to talk about the work and the importance of the clinical nurse specialist and how AMMF can help them. Oh, too soon. A little earlier, we heard Louise and Margaret explain how they work with their cholangiocarcinoma patients. And actually, some years ago, I was invited to visit Aintree, Liverpool, UK, the hospital where Louise and Margaret work, to meet and speak with the medical team involved in the care of the cholangiocarcinoma patient, and also to meet a number of the patients themselves. And I'm going to come back to that visit shortly because that made an indelible mark on me. But the first thing I want to do is to think about the patients, those who are diagnosed with cholangiocarcinoma. And for all those diagnosed with cholangiocarcinoma, the future seems very uncertain. Understandably, they can feel afraid, confused, isolated, and helpless. And these here are just a few of the many, sadly, very similar comments we've received at AMMF. And for carers and loved ones, understanding a diagnosis of cholangiocarcinoma and its implications can be as difficult for them as for the patient. And they too can be really shocked by the diagnosis and struggle to understand its implications. However, there's one clear factor that provides patients with a significant advantage, we've seen it today, and a more positive experience, and that is access to a clinical nurse specialist. This one thing can improve a patient's experience in every area. So, to return to my visit to Aintree, what was clear that day was that everyone gained from the obviously close relationship and trust between the patients I met and the medics responsible for their care, and particularly with the clinical nurse specialists. During our discussions with the medical team, the focus was very much on how to achieve optimal treatment for those with cholangiocarcinoma. And it was incredibly refreshing to hear. Surgery whenever and wherever possible, and maintenance regimes for optimum quality of life where that was not possible, with no age discrimination. The care and dedication that shone through all the medical staff I met during that visit was almost tangible. Wonderful people committed to doing the best they possibly can for their cholangiocarcinoma patients. And the strong recognition from all, the medics and the patients, that the clinical nurse specialists had an absolutely vital role to play in achieving this level of care. Well, being diagnosed with any cancer is the first step on a challenging and often highly stressful journey. But for people diagnosed with a rare or less common cancer, such as cholangiocarcinoma, life is arguably even harder. Frequently, those with cholangiocarcinoma are disadvantaged all the way through their journey. From the speed of diagnosis through to treatment and trials, unfortunately, many often receive a very poor deal. Various surveys and reports over the years have shown that all patients who are allocated a clinical nurse specialist with appropriate disease area knowledge report a far better experience through their treatment pathways and overall than others. Through my work as a board director of Cancer 52, the UK alliance of over 100 rare and less common cancer organisations, I've been involved in various projects looking at the work of the clinical nurse specialist in the rare and less common cancer area. One particular project, a report, clinical nurse specialists working with people with rare and less common cancers, drew together personal perspectives from both nurses and patients, with the aim of showcasing the work of the clinical nurse specialists in the words of the nurses and those of their patients. And through this, to highlight the invaluable support and humanity that they bring to treatment and care. Through AMMF, a clinical nurse specialist and a cholangiocarcinoma patient from the Christie were two of those interviewed and put under the spotlight. And this is a quote from Matt, a 49-year-old man who had cholangiocarcinoma, and shows just how clearly he valued the support from his clinical nurse specialist. And as you can say, he says, when you have a specialist nurse, it's like you stop being just an illness and become a person again. My clinical nurse specialist is pivotal, and the contact with her is hugely important. She's the first person I speak to when I need something. When I first met her, she said I could email her at any time. So if I wake up in the night and I have questions or I'm worried about anything, I'll get in touch and she'll get onto it the next morning. As Matt further explained, having a clinical nurse specialist is like having a virtual hand on your shoulder all the time. She gives me confidence. So we know how important they are, but how can AMMF help the clinical nurse specialist better support their cholangiocarcinoma patients? Well, we have a number of reliable resources freely available, a comprehensive website, various booklets and information sheets, and videos, and I'm going to just explain some of them briefly now. So I think as Margaret and Louise mentioned earlier, the first thing most people do when they get a diagnosis of anything, but especially something like cholangiocarcinoma, is to turn to the internet. We've all done it, and Dr. Google for information. And unfortunately, much of it is not very reliable, it's out of date, or it's inappropriate. But AMMF's website provides a one-stop shop with comprehensive and reliable cholangiocarcinoma information covering just about every area, including current clinical trials, and all in an easy-to-navigate format. This can be used as an information resource by nurses, or patients can be directed to it to help them understand their cancer better. And such is the huge demand for our original website that we now have a European version of the website too. We launched it earlier this year, and it's currently available in 8 European languages. So if clinical nurse specialists have patients whose English isn't their mother tongue, we have a number of other languages now that they can refer to, and we hope to have more to come in the not too distant future. I'm just going to quickly mention social media. How can you not these days? AMMF uses social media daily, using several platforms, Twitter, Instagram, and LinkedIn, plus of course Facebook. And on Facebook, we have our main public page, but we also have private groups specifically for patients and carers, and also for those bereaved by cholangiocarcinoma. And these groups are proving incredibly important in helping people reach out and help each other, and also to feel less alone. Well, patients need to have access to reliable information in a level of language they can understand. And we have a very useful and informative handbook on biliary tract cancers, which answers many of the frequently asked questions about cholangiocarcinoma, gallbladder cancer, and ampullary cancer. This was produced by ESMO with AMMF's cooperation and is now available in English and Italian, both downloadable from AMMF's website, with the English version also available as hard copy. And we do supply these to clinical nurse specialists up and down the UK, very useful to have. Fairly recently, we have worked with ENSCA, European Network for the Study of Cholangiocarcinoma, and Dr. Chiara Bracconi in Glasgow on producing downloadable patient information sheets which give full information on the 5 most commonly used chemotherapy regimes. And again, these are hugely useful. Each type of treatment is described clearly, how it's given, for how long, what side effects might occur, and how to deal with them. And as I've said, these are available as downloads now, but they're also in more than 30 languages. And this is the beauty of being involved with ENSCA. This work was produced under their Cost Action Project. You're going to hear more about ENSCA and the Cost Action Project tomorrow. But across the world, people became involved in this project and freely gave of their time to produce this incredible resource. We have a number of videos which clinical nurse specialists can use and point their patients to. These are all on AMMF's website. They cover topics such as nutrition, treatments, and importantly, as you've heard, the animation describing cholangiocarcinoma and the importance of molecular testing. And this is now a good point for me to start coming to an end. Again, you can ask me any questions you like about AMMF's resources, those that we have, or particularly nurses, please come to us and tell us what you think we should have and how perhaps we can help you better. But now I'm going to once again give the floor back to Dr. Rachel Greig from Incyte, who's going to talk, but perhaps in more detail, about molecular profiling and slightly different terminology, as this is geared for our nurses, and will again mention molecular testing in cholangiocarcinoma, the brochure which I'm just thrilled that we are launching here today. Thank you, everyone. And Rachel, back to you.
You said before, Helen, that you kind of wanted to hear the talk again because you wanted to absorb more information, so you're about to get it. Sorry to the people in the room, because a lot of this is going to be repetition, but for the people, because this is obviously streamed virtually, so for the people online, I believe that there's a lot more nurses that have joined now who won't have seen it first time round. So as Helen said, I mean, the slides are the same, the terminology is slightly different, but I will move forward, and then it's an opportunity to ask any questions that you might have thought of, and probably ask some more questions that are coming in. So to start the presentation again, just to remind the people here and the people on the phone, what is molecular testing? So it's known lots of different terms: molecular profiling, genetic testing, genomic testing. And what it's doing is it's looking for changes in a patient's cancer cell, on a genetic level. And so this is important because if you can understand what's going on at the genetic level, it can help doctors better manage their patient. And so I'm going to start talking, introducing an animation that Helen mentioned as well, that we worked on last year. I'll introduce the booklet and how CNSs can use the booklet to support their patients. And then I'll talk a little bit more about some of the content in the booklet. I won't go on so much about it here because I think probably what's maybe more valuable now is actually answering some more questions, so I can maybe skim some of it. Okay, so the animation that Helen mentioned was launched last year at this conference, this virtual conference, and the aim of the animation was to raise awareness of the importance of molecular testing in cholangiocarcinoma. And so it was used to support patients and their carers, but also the wider clinical community, including nurses, to highlight that this is something that patients should be getting as part of their care and their treatment management. So we can show it again.
My name's Erica. I'm 53. I've got 2 teenagers at home, and one of them has flown the nest. I work in an insurance company. I'm just like anyone else, really, except I've got cholangiocarcinoma. It's a rare type of liver cancer and one of the toughest ones to treat. My care team reckon I've had it for years. Getting diagnosed was a terrible shock to the system for me, my husband, and my kids. I'd had some pains in my stomach, but I didn't think they were serious. By the time I saw an expert, it was too late to operate. A few months ago, I didn't have any real worries, but now my life feels so uncertain. But my doctor tells me things are changing in cholangiocarcinoma, so I'm hopeful about the options that might be available to me.
Cholangiocarcinoma is a very aggressive cancer, and due to a lack of specific symptoms, it's often diagnosed late. This can make it hard to treat, and currently there are very few treatment options available for these patients.
My diagnosis came after a biopsy, like a big injection, except they take tumour tissue out instead of putting medicine in. It was just a small piece of me, but precious and incredibly important. It just may be a key to unlock new options for patients like me.
Molecular testing has become essential in the fight against rare cancers like cholangiocarcinoma. All of us have an increasingly important role to play. From ensuring enough tissue is taken during biopsy, to using it sparingly during diagnosis to make sure there's enough left over for molecular testing.
My team were great. They've made that tiny bit of tissue go a long way. And now I'm waiting. If certain genetic changes are found in my cancer, it might make me suitable for new targeted treatments. So, well, fingers crossed.
The cells in our bodies are constantly dividing. Sometimes, when certain genes in the cells change and become faulty, for example, when mutations occur, it can drive the cells to grow out of control. This is how cancer is formed. In order to try to stop the cancer growing, these faulty genes have to be brought under control. This can be done by selecting the right treatment. Almost half of cholangiocarcinoma patients have genetic changes, like FGFR2 fusions, which can potentially be acted upon. Molecular testing helps us to identify patients who have faulty genes in their cancer, and in turn, those who might benefit from targeted therapies that could significantly extend their life. And as more genetic alterations are being explored, we are creating a genetic footprint for the identification and treatment of the cancers of others in the future.
It's been a difficult time for sure. But knowing I might have a way to get a bit more time, that keeps me going. And even if I don't, it's nice how that little part of me has contributed to science. That it might help someone else like me in the future. That's something.
If you've been diagnosed with cholangiocarcinoma, ask your doctor about molecular testing.
Okay, so for those on the phone, as you saw with that animation, there's lots of different topics that were covered. And so one of the things we wanted to do was create a companion resource that complemented the animation. Because we know that for some patients, there isn't necessarily an interest in understanding all of the mechanics behind the different tests available. But for some patients, there is. And this was the plan for the book, to try and communicate some complex messages and themes in an easier to understand way. So the book is here. We have printed copies. We also have PDFs, which will be uploaded onto the AMMF website. If you have questions from your patients regarding molecular testing, you can direct them to there, and I can always send out physical copies to your hospitals as well. Either we can work with Helen to do that, or you can come directly to me. That's no problem. The booklet discusses, as I said, things like genes in cancer, more details on molecular testing and treatment targets, and questions that patients can ask their doctor. Within the NHS now, molecular testing is funded for cholangiocarcinoma, and this can happen at any time, but typically it's after a patient has been diagnosed with cholangiocarcinoma and once they're on their first-line treatment. And so patients during that time might then have questions about it. Their doctors might have mentioned it whilst they're starting that first-line treatment. And that's when they might have questions with the nurses, when this booklet might be of use. And so the booklet starts off discussing the theme of genetics and cancer, and so introduces the concept of all of our cells having our DNA, and the way that DNA is segmented is part of genes, and how these genes are codes for our cells to function and do what they're supposed to do, like making proteins. And when there's faults in the genes, when these cells replicate, this is called a mutation. And when these mutations occur, it can cause healthy cells to not be healthy anymore, essentially. It can cause them to act strangely and do things which they shouldn't, such as grow out of control. And so the book then goes into more detail about the types of mutations that patients can have, such as driver mutations or resistant mutations. Driver mutations being the things that cause the cells to keep driving out of control. Resistance mutations being mutations that are protective against those cancer cells actually being able to be attacked. And then the book also talks about the difference between inherited mutations and acquired mutations. So inherited mutations being those things that are passed down to us from our parents, and acquired mutations being things that act on our cells over the course of our lives. And so then it goes on to discuss the significance of these, of finding out these mutations, because although mutations are a problem, we now know that more and more we can use these mutations to our advantage, and targeted treatments are being developed, or have been developed, continue to be developed, that target cells with those faulty genes. And that's why molecular testing is so important, because it identifies a patient that has faulty genes that are driving their cancer. And then it determines whether a patient is eligible for a type of eligible for a clinical trial, or a specific targeted treatment. The book discusses what happens within the NHS typically around how molecular testing is actually carried out from the point of biopsy all the way through to the doctor receiving the molecular test results. And it also goes into more detail to describe the processes used in biopsy and also different molecular testing techniques. The book also then discusses some common gene faults that are found in cholangiocarcinoma, and these are different that are usually found in other types of cancer. And different types of cholangiocarcinoma have different types of faults. So for example, intrahepatic cholangiocarcinoma may have different faults than perihilar or distal. And so the book talks about that in more detail, and also then talks about how likely a patient with a different type of cancer is going to have one of these mutations. So it tries to break it down as to the number of patients who are most likely to have a potential mutation and what that might mean. The book then also has a list of targeted treatments which are currently approved and reimbursed within the NHS. And the idea for this book is it's not going to be, this isn't the end. So every time a new drug is approved for use on the NHS, this book will be updated. So we'll always have a complete guide of targeted treatments and targets of significance within the NHS. And then we spoke, the nurses spoke earlier about the importance of managing expectations of patients, and we've tried to include that in the book as well. And I'm looking directly at you to try to create that, include that in the book, because I think there can be sometimes a thought that, you know, it's really good if a mutation is found because then I'll definitely get a targeted treatment. But sometimes if a mutation is not found, and it can lead to disappointment, but it's really important to know when a mutation's not found, because you don't want to give a targeted treatment to a patient where it might not work. Because all cancer medicines have side effects and toxicities. And so if someone's not going to benefit from that treatment, you don't want to cause them potential harm. And that's it for the second time. I am, available for questions.
Thank you again, Rachel. That was great, and I got the nuances in there where you changed things slightly. But as I say, it was very much directed to our clinical nurse specialists or any nurses with an interest in cholangiocarcinoma. That this new booklet and the information about molecular profiling will be hugely useful for your patients as we move forward. We are now once again open for questions, and for those of you joining us virtually and those in the room, you can submit via the chat forum on the app. But I'm going to ask Gary to join us once again and field some of the questions with us and for us. I think we had some left over from the first session, so if you feel that they are suitable, Gary, maybe we could deal with some of them in this session, depending on how many nurses we get wanting their questions answered.
Exactly. So I think, just as a reminder, I think this is an opportunity not to only ask questions to Rachel on the presentation you just saw, but also on the presentation delivered by Helen on how the AMMF supports clinical nurse specialists as well. We do have a couple of questions that have come in during the session, and we've also, as you mentioned, Helen, a couple of the questions from the previous session are probably appropriate as well. So I can see we've got a question from the room at table 15, and we'll jump to that first, if that's okay.
So I know that you said earlier on that you can have the molecular testing done every 3 months, 6 months. So would there still be any of your biopsy left? How does that work?
Yeah, so that's a really good question, actually. So at the moment in cholangio, probably you wouldn't keep having molecular testing done every 6 months, but that might happen in the future, depending on treatments that come through. It's a really good question. We know that biopsy can be quite difficult to get, and sometimes there's not very much tumor tissue in the biopsy. One of the things that I'm doing as part of my engagement with doctors is discussing with histopathologists the best way to conserve as much tissue as possible for molecular testing. With some of the other cancers, like blood cancers, hematology, it's quite easy because you can just keep always doing another blood test. And that might be where liquid biopsy comes into its own later, in years to come in cholangiocarcinoma, because having to have a patient be re-biopsied is not necessarily what you want to do. So I think that's probably in the future. And I know in America that actually is happening, and there's some clinical trials in the States that do constant liquid biopsies to look for those resistance mutations. So yeah.
Thank you.
No worries.
Thank you. So another question that came in actually from the previous session is, can molecular profiling be used as a screening method for cholangiocarcinoma?
No, because it isn't the genes that you're looking for in cholangiocarcinoma aren't ones that are inherited. So I spoke about the difference between inherited genes versus inherited mutations versus driver mutations. The mutations that we're looking for in cholangio are ones that have occurred and what is actually driving a cancer. So in terms of screening, those ones that are passed down from family members. So we don't have any significance, we don't know any significance of kind of inherited mutations yet for cholangio. So not yet.
Thank you. I can see we have another question from the room, table 14. So
is it switched on? Thank you.
There we go.
It's actually 2 questions, if that's okay. My first question is, I work at the Christie, and within our practice, we are very much driven by when a disease becomes resistant to the treatment that we're on for doing the molecular profiling. But we tend to use a tumour sample that's already in existence for obvious reasons, not putting a patient through a biopsy. However, if it is that disease has become resistant, kind of my mindset is it worth rebiopsying to get a different profile if it has indeed mutated beyond sort of what the original sample was? Sort of what would be the difference there?
So the only I think I understand your question. So if a patient has become resistant to a treatment, you would only do another molecular test if there was another treatment for that patient to get. If there isn't, then there's no point of doing it. So at the moment, there aren't enough treatments approved to warrant doing it again. The thing with the tests that are done at the moment, you can do them early on with the original tumour sample. It won't change over time because those are the driver genes. And like I said, resistance mutations don't, we can't do anything about them at the moment within the NHS because there's just not enough treatment. So, yeah.
Thank you, that makes sense.
But there are trials, aren't there?
There are trials, and there are things, like I said, in the States, they are doing it and things. So it will start coming, but not yet.
And my second question was just the liquid biopsy, does that do the same profile as a tissue biopsy? Does that come up with the same?
Do you mean if you're looking for the same genes?
Yeah, because I know there's a lot of genes that are tested, isn't there? Is it the same?
So the technology is slightly different, but yes, you're looking for the same genes.
Lovely, thank you.
So there's actually a question that's just come in from the virtual audience to follow on from that actually, is what is the percentage of actionable mutations found by molecular profiling?
Yeah, that's a good question. So around 50, it said in the animation, and it's in here, around 50% of patients might have a mutation of clinical significance. Actionable mutations, again, it could be around 40 or 50%, but it kind of depends, like I said, on what type of cholangiocarcinoma a patient might actually have. And also the problem is at the moment because we're waiting for some treatments to come through. So of course, yes, there are clinical trials, but yeah, we'd say around 40 or 50%, depending on the type of cholangio that a patient has.
Thank you. So one more question, Rachel, before I go to Helen with a question that came in from, are there different types of molecular profiling used to identify cholangiocarcinoma?
Yes, there's different types of tests, but in the NHS, generally, the different labs use the same type of test. There's some information on this. I don't know how technical I should go here, but the technology that's used can look at hundreds of different genes all at once. So it is like the gold standard technology the NHS actually adopts. But sometimes, as we spoke before, about when there's not very much tumour tissue, some other types of tests can be used which don't need as much. They can only look at one gene at a time, but that's also available within the NHS.
So I actually have a question to follow on from that. So if we're performing molecular profiling and identify genes where there's no approved therapy, is there a database or record of those genes being kept for potential future treatments?
That's a really good question. So it's my understanding that the NHS does keep all of the data. It's anonymised, but they just know that, patient X has there's a mutation found. So the NHS keeps the data. And then, yes, I think the data could be looked at retrospectively. When other as part of other research, as part of wider research.
Excellent, thank you. So Helen, a question that came in response to your presentation, two questions actually. The first is the AMMF does an amazing job at keeping all of its information and support materials up to date for both healthcare professionals and primarily patients. What is the process that you go through to keep that information up to date? And then the follow-on question is, what are the plans for the AMMF for future support materials for clinical nurse specialists? You don't have to have the answer, but...
Well, we rely very much on the close links that we have with a huge number of cholangiocarcinoma specialists throughout the UK, throughout Europe, in fact globally, to come back to us and tell us about clinical trials and tell us about updates. We do have close links with industry, as obviously you've seen the work that we do with the support of Incyte and others does help us enormously to supply good, useful resources. Something we wanted to do for a long time, and maybe we will have it as a future project, is to set up a network of clinical nurse specialists throughout the UK and possibly well, there are no clinical nurse specialists in Europe, which is a huge other area. But so that what I think it would be nice is if we could have some sort of database so that clinical nurse specialists could actually help each other. You know, I have this patient, they're asking me this, you know, maybe some sort of forum that's especially for the clinical nurse specialist. You know, anybody got any ideas what I can do, how I can help this patient? So that is something we would like to do in the future. We just throw our nets as wide as we can and bring in as much information as we can and try and keep it as up to date as we can. Have I answered everything that you asked?
I think so.
I did want to come back on the lady who was talking about screening and asking if molecular profiling could be used for screening. Well, you might be aware there's a very interesting trial going on at the moment, which is called the Gallery trial. And it's run by an American company called Grail. Do you know about this? Yeah. It's actually now, the trial is running in the UK. There's a lot of information about it on AMMF's website. But this is a liquid biopsy. This is taking some blood and screening the blood for, get this right, ctDNA? Yeah. Is that right? So circulating tumor DNA. Now, this trial apparently can detect 100 different types of cancer quite reliably. And what we're all most interested in is, I believe it's up in the top 10, are the 3 different types of cholangiocarcinoma. This trial is so sensitive, it is picking these out. Now, you can't just go and join the trial. You can't ask to be in it's going out to GPs, and I think it's selected. The control arm is just people who have no history of cancer in their families at all, but then they're also picking out people who do have family histories. But I think what I'm saying is watch this space. You know, do check out the Gallery trial, GALLERI, which is run by Grail, GRAIL. Look up the Grail company. It's very, very interesting to read about this. But that, to me, this is the future. You know, and if we could really, I think it's quite a lengthy trial. It's covering thousands of people. But if this comes out positive, that will be something very exciting for us, because there isn't, as we all know, there's no screening for cholangio at the moment. Yeah.
So we have got about 5 minutes to go. My watch is now telling the right time. We don't have any other questions.
Well, I have one, if I may.
Please go.
We're talking about molecular profiling. Now, in my mind, I'm thinking anybody who gets a diagnosis of cholangiocarcinoma should be immediately saying to their doctor, will you run a molecular profile test for me? I know at the moment everybody has to go through their first-line treatment, but really, is this something we should be pushing for, to say, have it done now, because you don't want to wait till you get to the end of your first-line treatment.
Yeah.
Then you're wasting the time and so on.
So generally what I think is happening within the NHS, patients might start their first-line treatment and then the test is ordered. So it's not necessarily they have to wait to the end of their first-line treatment. What you've described is something called reflex testing. And that means that before the oncologist doesn't even have to ask for it. That all is done, like at the earlier point, as part of the diagnostic. If they think it's cholangio, the histopathologists send the samples away, the test is done, and at the first MDT meeting, all of the information is presented. So yes, I think so. I think more and more a lot of hospitals are already setting up reflex, but some aren't. And so yes, I think my messaging is always test as early as you possibly can. And then for oncologists and pathologists in their hospitals to discuss the possibility of reflex testing.
Yep. So we have to really keep pushing, don't we?
Yeah, and I think we know that cholangio, it can be it's an aggressive one. It can move quite fast.
Yeah.
So I think anything you can do to get information at an earliest possible time, it just gives the doctors the information in the back pocket to act on it as soon as they can.
Absolutely.
Yeah.
Yes. Thank you for that. That's good. And I have one more, if I may.
Yeah.
Right. We talked about. We are talking about the molecular profiling being available through the NHS, but are people free, even if they're under the care of NHS doctors and physicians, consultants, to actually go and get their testing done privately and then come back and say, look, this is a really comprehensive report?
Yeah, you can. I mean, I would hope now the panels that the NHS are using pretty much covers everything. It may not be reported on because there might not be a treatment, but often doctors will ask for the report and can kind of try and, look for clinical trials or whatever. But yes, it's available in the private setting as well. There's different labs throughout the country. I think you can just Google it. I believe it costs about £500.
I thought it was a lot more than that, but maybe as it's become more.
Yeah.
Not use the word common, but commonplace.
I think what would happen, I think there's probably different examples, but the patient could have their biopsy sample, they could request the biopsy sample sent to the private lab, and then the lab can do the test, yeah.
Great. I'm sure you're going to get loads more questions when people let this information filter down into their brains, but it's, as I said previously, this is so exciting to have this now, and also to have the new targeted therapies coming through on the horizon, and also the one that the people are looking for therapies, because we know that you get your targeted therapy, but then you may get this resistance.
Yep.
What next?
Yes, exactly.
And that's what we're also looking at, to find the what next, and it's all about maintenance and keeping things going. So once again, thank you so much, Rachel. It's been a real pleasure having you with us.